The Trump administration, through its Department of Government Efficiency, has launched a series of budget cuts that strike at the very heart of America's commitment to its children. These cuts, far from promoting efficiency, threaten to dismantle essential programs that millions of families rely upon. From early childhood education to healthcare, from child protection to basic sustenance, the administration's actions paint a grim picture of a nation willing to sacrifice its future for short-term gains. Agencies like the Children's Bureau and the Office of Juvenile Justice and Delinquency Prevention, tasked with safeguarding the well-being of our most vulnerable citizens, are starved of resources. Their vital work hampered by a lack of funding and political will. These cuts are not mere abstractions, they have real and devastating consequences for families across the country. In rural communities, where poverty rates are often highest and support systems weakest, the impact is particularly severe. The administration's actions reveal a callous disregard for the plight of struggling families, particularly those living below the poverty line. The promise of equal opportunity, a cornerstone of the American dream, rings hollow as children are denied the basic necessities to thrive and succeed. The administration's rhetoric of fiscal responsibility crumbles under the weight of its own hypocrisy. While claiming to streamline government and eliminate waste, the Department of Government Efficiency has created a labyrinthine bureaucracy that hinders access to vital services. The Defend the Spend website, touted as a tool for transparency, has become a bureaucratic black hole, swallowing up funds intended for essential programs like Head Start. This cynical shell game leaves vulnerable families in limbo, their hopes dashed by empty promises and government indifference. The assault on children's programs is not an isolated incident. It is part of a larger pattern of regressive policies that disproportionately harm the poor and marginalized. From tax cuts for the wealthy to deregulation of industries that pollute our air and water, the administration's priorities are clear. The pursuit of profit trumps the well-being of our children, and the consequences will be felt for generations to come. This is not simply a matter of budget cuts. It is a moral crisis that demands our attention and action. Among the casualties of the Trump administration's war on children is Head Start, a program that has provided early childhood education and support services to low-income families for over half a century. This vital program, which serves 1 million children nationwide, faces elimination under the current budget proposal. The potential loss of Head Start represents a devastating blow to families struggling to make ends meet, robbing their children of the opportunity for a strong start in life. For many low-income families, Head Start is not just a preschool program, it is a lifeline. In rural areas where affordable childcare options are scarce, Head Start centers often serve as the only source of early education and care for working parents. These centers provide a safe and nurturing environment where children can learn, grow, and develop the social and emotional skills necessary for success in school and beyond. They also offer crucial support services to families, including health screenings, nutritional guidance, and parental involvement programs. The elimination of Head Start would have immediate and far-reaching consequences. Parents, forced to choose between work and childcare, would face impossible decisions. The loss of income could push families further into poverty, exacerbating existing inequalities. Children deprived of early learning opportunities would enter kindergarten at a significant disadvantage, less prepared to learn and more likely to fall behind. The long-term costs, both in terms of lost human potential and increased social spending, would be immeasurable. The administration's attack on Head Start is not only short-sighted but also deeply misguided. Study after study has demonstrated the effectiveness of early childhood education in improving outcomes for disadvantaged children. Head Start graduates are more likely to graduate from high school, attend college, and earn higher salaries than their peers who did not attend the program. They are also less likely to be involved in crime, rely on public assistance, or experience health problems. Investing in early childhood education is not just the right thing to do, it is the smart thing to do. The Trump administration's budget cuts have also eviscerated programs designed to protect children from abuse and neglect. Funding for child protective services, already stretched thin in many states, has been slashed, leaving caseworkers overwhelmed and vulnerable children at risk. The social services block grant, a critical source of funding for child welfare programs, has been decimated, forcing agencies to make impossible choices between essential services. The consequences of these cuts are dire. With fewer resources and staff, Child Protective Services agencies are struggling to investigate reports of abuse and neglect in a timely manner. Caseworkers, burdened with unmanageable caseloads, are unable to provide the necessary support and oversight to families in crisis. Children, left in unsafe environments, are at increased risk of further harm. The administration's actions are a betrayal of our collective responsibility to protect the most vulnerable among us. The assault on child protection programs extends beyond Child Protective Services. Funding for programs that investigate internet crimes against children, track down missing children, and issue Amber Alerts has been delayed or blocked. The Department of Justice, responsible for prosecuting those who exploit and endanger children, has seen its budget slashed, hampering its ability to pursue justice. The administration's actions send a chilling message that the safety and well-being of our children are not a priority. The dismantling of child protection programs is a moral stain on our nation's conscience. It is a testament to the administration's warped priorities, where tax cuts for corporations take precedence over the safety and well-being of children. We cannot afford to stand idly by as the safety net that protects our most vulnerable citizens is shredded. We must demand that our elected officials prioritize the needs of children and restore funding for these vital programs. The Trump administration's assault on children extends to their very health and well-being. An estimated 800,000 children have already lost access to health care due to cuts in programs like Medicaid and the Children's Health Insurance Program. These programs, which provide a lifeline to millions of low-income families, are under constant threat of further cuts, putting the health of a generation at risk. Medicaid in particular is a crucial safety net for children, covering nearly 40% of all children in the United States. It provides access to essential healthcare services, including doctor's visits, hospitalizations, immunizations, and prescription drugs. Cuts to Medicaid would have a devastating impact on children, particularly those with chronic illnesses or disabilities. It would mean children going without necessary medical care, families facing financial ruin due to medical debt, and in some cases, even preventable deaths. The administration's proposed cuts to Medicaid are not limited to direct funding. They also include changes to the way the program is financed, shifting more costs onto states, which would inevitably lead to further cuts in eligibility and benefits. These changes would create a two-tiered healthcare system, where children from wealthy families receive quality care, while children from low-income families are left behind. The administration's attack on children's healthcare is unconscionable. Access to quality healthcare is a fundamental human right, and no child should be denied this right because of their family's income. The consequences of these cuts will be felt for years to come, as children grow up with untreated health problems, leading to lifelong challenges and disparities. We must resist these cuts and demand that our elected officials prioritize the health and well-being of all children.